My name is Dr. Richard Casden. I am the founder and senior ophthalmologist at Acuity Eye Care. The practice itself began in 1980. My feeling was that the best way for me to really serve my patients was to offer them the expertise that I had and to complement that with the addition of other doctors. So in 1993, I was able to welcome in Dr. Betty Klein, who is our vitreoretinal specialist. And in 1999, we were fortunate in being able to add Dr. Hindola Conrad, whose specialty is oculoplastic surgery. We have a staff that is very, very dedicated. They are extremely compassionate, and I should also add multilingual. We offer state-of-the-art ophthalmic care, and I specialize in cataracts and lens implants and glaucoma. We have to be extremely precise in what we do, paying meticulous attention to detail, using the most precise instruments and sutures when we need to, and creating the most perfect result that we can, all under a microscope. So really, we are the ultimate plastic surgeons on the planet. So many of you realize that there is an ongoing cost. There's a time issue, there's a cost to having to get glasses every few years, to having to replace them. They chip, they break, they scratch, the coating wears off, the frames bend. So when we have the ability to essentially diminish the need for those glasses, or in some cases eliminate them, I love to be able to offer this to all of my cataract patients. Very simply, a cataract is a loss of clarity of the normal, internal focusing lens of the eye. Now, the treatment, and I am referring, of course, to state-of-the-art treatment, is removal of the lens, replacing it with a permanent plastic intraocular lens. The new lens goes back into exactly the same anatomical position that the original lens was in. The take-home message for my patients: we do this operation once. One for one eye, one for the other eye, done. In 2005, I began performing my operations away from hospitals at the Wilton Surgery Center. The costs of performing surgery are substantially less than a hospital. Wilton features a staff who really understand that the modern surgical patient doesn't want to be treated as someone who's sick. They want to be treated in a comfortable, non-threatening environment. Because we can be out of the hospital environment, we can essentially eliminate the risk of hospital-acquired infections. That's just the reality of it. And we'll do a little dance.
There you go.
Thank you. How's everybody today? Everybody good? Vanessa is going to give you some nice sedation to get you nice and relaxed. I'm always concerned about the patient regarding their apprehension. They often wonder about, will they be given medication to make them comfortable? Will they be fully awake? Will they see what's going on? How will they keep their eye open? How will they keep their eye still? Well, we've taken care of all of this. The nurses, before the operation, anesthetize the eye with a special gel, and this numbs the eye significantly and really makes it unnecessary for me to use any sharp needle. Vision is actually temporarily very blurred, and the patient might only be aware of vague shadows. In fact, I've had a number of patients comment that it's actually a pretty neat light show with some really, really beautiful colors and almost like a July 4th fireworks display. The intraocular lens itself is only 6 millimeters in diameter, and we are able to insert it through an incision that is only 2.4 millimeters, and it's placed safely in the same place that the original cataract used to be. The advantages of this procedure versus the LASIK is that the implant is permanent, it will not fade, it will not change, it will not degrade. In short, they are like wearing permanent progressive eyeglasses, except for the fact that these are internal and these are in the eye. So I've been extremely pleased, and my patients uniformly have really raved about the care they've received at Wilton. Despite the fact that I've performed in excess of 10,000 cataract operations over the years, performing surgery on the human eye is both exhilarating and also very humbling. It's a privileged responsibility. I'm focusing on every patient as if it were the first time I was doing it. I think that I still bring that kind of commitment and that kind of focus to every one of my patients. I don't think that'll ever change.